Kenko Hacks, a podcast about wellness, health, and biohacking.
Konnichiwa. This is a podcast from Kenko Hacks. I'm Eva. Today we are very excited to have as our guest Ulrik Hjerpsted, a medical doctor and a partner at Copenhagen Center of Functional Medicine. Ulrik, welcome to the show.
Thank you for having me.
Glad to have you here. You have a very interesting background. You have a conventional medical training in surgery, and you are a vascular surgeon. But you got interested in functional medicine some years ago, and today you are a partner at Copenhagen Center of Functional Medicine. So can you tell us a bit about yourself and how you got interested in functional medicine in the beginning?
Yes, I can. It all started off, I think, with a salmonella infection in 2001 and in Thailand. And I was admitted to the hospital and got a lot of antibiotics so they could send me home fast. And slowly my gut health started to go the wrong way, and I started to have food intolerances. And then I started having a slight inflammation in the joints after running, and I tried to I talked to different doctors in Denmark. Being a upcoming vascular surgeon, it's hard. It's easy to get access to wise people in Denmark, wise doctors, professors, and stuff, and they all took blood samples to say nothing's wrong with you, everything looks fine. But I could feel after running my joint hurt, and it slowly got worse over the years. And doing vascular surgery, you had to stand and for 8 hours sometimes with the big aorta surgery.
Yeah.
And it became troublesome for me to do my job. And I got slightly desperate, so I started researching on my own, like different bacterias and what could increase inflammation and what could decrease inflammation. And I used quite some time doing research about this, and it led me to the path of functional medicine, where I found out that a lot of the food choices we take today can increase inflammation by modulating the gut microbiome the right or the wrong way.
Yeah.
So I started exploring that more and more, and even though the doctors that I met says nothing wrong with you, I with my own experiences with food choices and fasting, I started to get better really fast. So after that, I thought I like vascular surgery. I really enjoy doing it, but I also like to help people. It's probably one of the calls of being a doctor, that you like to help people. But so I wanted to spread this information to people. So that's why I started the Center of Functional Medicine to try to help Danish people with these topics, because it's very hard for a person that's not a doctor to go to a doctor and say something's wrong with my joints or with my skin, and the doctor says no, nothing's wrong with you. You don't have the education to question that statement. So I'd like to open this clinic so I can help people and listen to people's problems. So I can say, yes, something is wrong with you, and it is curable, or we can at least help decrease the problems by 80% to 50 to 80%. Like if you have joint problem, maybe we cannot cure you, but we can at least make it way better with right food choices and lifestyle changes. So I want to share that with the world, especially the Danish world, the Scandinavian world, because I think people in other countries are way more ahead in functional medicine, especially in the States. It's very normal.
Yeah.
In Denmark, it is not so normal.
Yeah, wow, that's very interesting story. I had no idea. So, actually, you experienced your own personal health issues as a doctor, and you consulted other doctors in their specialty, like maybe immunity,
professors,
right? And they said nothing is wrong with you, and you are like, but I'm experiencing something. I know that something is wrong. So you took you took the problem to your own hands. And that's really interesting story, because as you say, I think you are a surgeon, so you are like you have very good medical background, and still like confronting other doctors who said, well, nothing is wrong with you. It was tough for you, I guess. And for normal people like us, it's even tougher. As you say, we have not enough medical knowledge. Maybe doctors, dismiss our complaints. So it's such a fascinating story to really, really,
Yeah, it is
really
kind of
hear.
shame that normal medicine in Denmark and probably also in Scandinavia is very much into the acute indicators in the blood sample. So they look at like the leukocytes and see if they're high as an acute inflammation. But a lot of the problems with our new or our testing in the healthcare system nowadays it only looks at the acute factors. So it is only if you're really sick that it shows a positive outcome or a negative outcome, but a positive result, like there's something wrong. So if we talk functional medicine, we look very much into how is the person feeling. Is there something wrong? Yes, it hurts here. Okay, then there's something wrong, and then we try to fix it together. We don't have to have blood samples saying, okay, this number is really high. We need to get that down. Like in functional medicine, you talk to the person, and you listen to all the problems he or she had in the like prior to the visit, and what problems are there now, and then you try to have some logic behind it with the knowledge that you have as a functional medicine doctor, and then you try to fix it slowly in the right direction.
Yes. Yeah.
um,
So I guess that eventually then, after you took the problem into your own hands, you are able to improve your health, your problems, little by little. And today you are probably feeling better, or maybe even better than ever, since you have learned quite a lot about functional medicine, I guess. And this is probably related to how you started Copenhagen Center of Functional Medicine. Is
that's
that right?
correct.
Maybe you can share with us how the background stories of the center, Copenhagen Center of Functional Medicine. How did it get started, and what do you do at the clinic?
Yeah, as I told you, it started out with with this bad history of meeting the healthcare system in Denmark, and they are not being very open to new research, and they're not very open to like food as medicine. So I started out with my colleague Oscar to try to get this center up and running. We have a clinic in Storkommensgade 88, where we have consultations. Normally, it doesn't take like 100 consultations or a lot of medicine. It takes small changes in your dietary intake and your sleep habits or you exercise habits. It doesn't take a lot of consultations to fix your health in the right direction. So normally we have best case scenario. You have like 3 consultations where you start off with a big background check where we take the history, the health history, and then we try to find out what seems to be the problem, and then we start out with like dietary changes, supplements, and suggestions to lifestyle changes. And like in 95% of the cases, we can change in the positive direction just by doing that. If people then come into a checkup 14 days to a month later, we can see what was hard and what was easy for the client to do the adjustments in their lifestyle. Because not all people are like, I have clients that come in and I ask them to do changes and they do 100% right away. And then I have clients coming in and they do yeah 5% changes of the one that I asked them, right? So it's really hard for the different kind of persons, depending on their mentality, if they're easy to change lifestyle and diets. and other people are just maybe not desperate enough, maybe they don't want it enough, maybe it's just really hard for them to do the changes. So when they come in again, we talk about, okay, how can you substitute the things that you cannot leave behind, like is
Yeah.
it gluten? Is it lactose? Which substitutes can we use instead of that? Is it snacking? Are you snacking late time? What kind of snacks could you substitute instead of sugar and other things? Then what can you substitute your cravings with? So you get like this, you get like a gray zone where you can work, and maybe it doesn't add up to being the way that I wanted it to be, but it's something that the client can do and relate to, and it works for them. So normally we, at the checkup, we try to implement or change things so they do the changes in a positive way. Maybe not 100%, but maybe we get up to 50%, and then they slowly find out that, oh, this is really helping, so maybe I should do the things that he asked in the beginning. And then we do 2 months or 3 months checkup, and then we see everything is working, or they're back to normal, or what they want.
It sounds like you have to be quite a good investigator of the patients to be a good functional medicine doctor. You have to ask a lot of questions and really dig into the details of their lifestyle.
Yes, you have to be quite an investigator to find the correct answer to problems. And I feel like having a clinic like this, I don't meet the easy cases. I meet the very complicated cases, the one that persisted for a long time. Or
Right.
so it's very severe cases of autoimmunity in different ways and aspects. So it's for me, it's also very interesting every time I see a new client, because they all have their different cases, and I really like the way most of them play out, because all of them feel improvement after like 14 days.
Yeah, that's really fascinating. I checked the clinic's website, and there's a link to the team who work at the clinic, and that includes a very wide range of disciplines. Like I have seen psychology, physical training, and even some health device expert. So can you tell us, like, if as a patient at the clinic, do they speak to all those experts separately, or how does it really, this investigation really work? Do they speak to many different experts?
Depending on the problem at hand, like if they come in with a clearly medical problem, it's mostly my point of views that I get. If they want, like the best case scenario would be to talk, and that's why we have collected these experts under the same roof, or the possibility to talk to all these experts. Normally it's like one at a time. But if I like set up a diet for a guy, and he doesn't stick to the diet because there's trigger thoughts that make him eat differently, or the way, then he could see this psychologist about what can he do with his trigger thoughts. And maybe he's stressed also, so this psychologist at hand, he's his specialist in stress, which I think has a big impact on the gut health, but also like the overall health. Then yeah, so it's really like sometimes we talk about different patients, like uh, together, the team, to see how we can get the best outcome for the client.
Yeah,
We
but
also have concussion patients, which also
yeah,
is as a big factor in the psychologist
yeah.
field.
It's really fascinating. As you say, I could easily imagine that the cases, the patients you get at the clinic are not the easiest ones, with very complex long-term problems and issues of their own, and each case is unique. And you are trying to really investigate their issues, the root causes, and trying to investigate their lifestyle and how they can be compliant with the treatment plan. It's really holistic approach. That's really fascinating.
Yeah.
Yeah.
I'd say also my biohacker mind says that I must also get like some data from the patients. That would be really useful, because if I get like Aura Ring data from the patient, I can really help them more in the sleep hacking and how I optimize their sleep health. Because sleeping is very important. It's crucial for a good health that you sleep right. And if people say, "Okay, I sleep fine," yeah, but do you really? So I don't. If I don't get data, yeah, but I don't, they go to bed and they wake up. But is it? Do they score 60 on the Oura ring or do they score 90? Like it's a very big difference. Is if their health is going to improve, that they get the score up close to 80 or 90.
Yeah, I also wear Aura Ring myself, and I can completely agree that it really makes huge difference to get the data rather than just how you feel subjectively. It's also important, but like to see the numbers, it really makes a difference. And I understand then you can access to patients' data because I know that Aura Ring has this kind of sharing option, I believe. So they can share their data with you, so you can like monitor how your patients are sleeping, like on your screen, or something like that.
That would be me monitoring all my clients at the same time would take a big effort. But we normally, when clients are here in a consultation, we walk through the different days, like a week, 14 days back to see what's going good, what's going not so good, how can they improve that. A lot of patients had problems with waking up during nighttime. And a very easy trick is to not drink as much after 6 o'clock. So it's try to get your 2 liters of water from the morning and up instead of trying to, oh, you come home from work at 5 or 6 and then, oh, I need to drink my 2 liters. And then you drink your 2 liters of water and then you go to bed and you wake up like 2 o'clock at night, but you don't want to go to the bathroom because it's cold and they're so far. So you go fall asleep again and then you wake up 15 minutes later, still have to go to the bathroom. So it's like really disturbing for your good quality sleep. So I really suggest that people drink your water in the morning or in the afternoon if you want to break fasting.
Yeah, small thing, but that makes a big difference to the quality of your sleep. Totally.
Especially.
Yeah. So at the clinic at the Copenhagen Center of Functional Medicine, how do you approach a patient? You already mentioned a couple of things like nutrition and holistic approach, but when the patient makes their first appointment, what happens next? Do they take a blood test or what happens then?
That's I'd I'd love to say that we would take blood samples to test the lipid profiles and the low grade inflammation. But at the moment, we don't have the setup. But we have the machines in order. We just need a place to set them. So it's soon going to be a thing for us with the blood samples. But at the moment, I send them out house if I need them. But I believe that a lot of things can be adjusted just by like first consultation. Small changes could really have big impact on your health. Cutting out a few things of your diet can really have huge impact on your health. So I start off with without the blood sample at the moment, but hopefully in this year we will have the possibility to do a full range of blood panels, so we can see the improvements also like clinically, so we can easier like motivate our clients to go the right way. Um, I didn't say before, but if we don't see changes after 2 or 3 consultations and and the clients are doing what they should, there's different things you can do. You can do fecal samples and you can test if there's any pathogens in it. You can do blood samples also for cytokines and you can check if they have low grade inflammation still or if there's something else. If the diet change is not working, if there's something persistent in the gut, you can also do the kill diets with different kind of herbal antimicrobials and antifungals. So there's really a lot of ways to do it. It's not like, okay, 2 consultations and we're out. No, it's like we're trying to figure out the problem together. So it's like you go hand in hand to see if okay, if this not working, why is it not working for you? Because every person is different. It's not like I know everything about everyone. It's like when they come in, then we try one diet, and if that not working, maybe it working the wrong way, like maybe too many fibers in the vegetables that suggest on the first consultation, then maybe we should go lower veggies. Like, so there's different diets that you can approach depending on what person and how they react on the first consultation. So it's really crucial that you give it a go at least 3 or 4 consultation to get to the goal of having improved health.
Yes. So you are like more like personal coach, personal health coach to your patient. It sounds like you follow up and you really take their hands, hold their hand towards the goal of optimized health. And I think it's a really big commitment from yourself to, because each patient is so unique and it's a big challenge. I can easily imagine.
Yeah, it is. It
Yeah.
is. It is because as I said, it's not like there's everyone is different. N
Yes.
equals one, as you say in biohacking. So I can only try to help people understand their bodies better. So if I have a patient that eats tons of tomatoes and get joint pain, I cannot feel the joint pain. So if they say it feels fine when I eat tomatoes, but negliges the joint pain, or it comes 2 days later, I cannot help them. They
Yeah.
need to be very open about all the problems, and it goes all the way from how the bowel movements look, and how many times a day, and if they, like, every symptom matters, so I can easier pinpoint the way. So I'm really trying to help people become wiser in their own dietary choices and in their own body. So I'm just trying to make people better at understanding how the body works to different food
Yeah.
choices, lifestyle changes.
Yeah, I think that compliance or the patient's motivation is a huge thing in functional medicine because, as you have hinted maybe a couple of times before, it's really about lifestyle changes like nutrition, sleep, and some, as you say, some people are like 100% compliant, like start feeling great immediately, but other people for some reason are compliant much less, like just 5% of what you have recommended them to do. Then it is a little bit much more challenging for you to maybe it's frustrating for you sometimes to see such patients, like, but I have given you all the advice but you haven't done anything.
Yeah, I totally agree. I did start out with some clients that was friends of mine, and I followed them on Instagram. And every time I look at their Instagram post where they were eating all the things that I told them not to, I get kind of irritated. So from now on, I don't follow anything that I advise. So it's because it's really frustrating to want to help people from the deepest part of my heart. I want to help people, but when they don't want to help themselves, it's really hard. So it's really about people's own commitment. And you
Yes.
can say in the beginning of my clinic, I had a lot of patients that was friends of friends, and I started out with them, and they maybe the problems were not so severe that they wanted it 100%. But when I get clients that has really severe problems, they also commit a lot. And that's the patients I also see the biggest changes in, because if I tell people to stay off gluten and lactose for a month just as a test, if they do it 100%, then you can get the right answer. Are you lactose or gluten intolerant? If you just eat it like once a week, it's not staying off it. So I don't get the right results. I don't get the right answers, and it's really hard for me to like fix people if they don't commit to trying the things that I suggest.
Yeah, totally agree. And that's actually one of the reasons I think it's very important to wake awareness among people, among ordinary people like us who are listening to the show, to the importance of optimizing health in the way you are doing. Because as the awareness increases, I think people's commitment, hopefully also, or compliance with such a treatment plan will also increase. It's all about their own motivation, basically. So I hope that a show like this can be a little bit of help for that awareness as well. So after a diagnosis is made for a patient, what types of interventions are usually used to optimize their health? I could imagine that that's very much case by case, but you already mentioned nutrition. I can imagine that that's very big part of functional medicine protocol for almost every patient.
So a big part, like the four pillars of health in functional medicine, is like mental health, it's exercise, it's diet, and sleep. So it's the four pillars of functional medicine, where you really try to improve all the four pillars at the same time. But it's a lot about like for the food choices, I really use a lot of elimination diets. So I start off with a really strict diet, and then like a lot of people can handle a strict diet because it excludes a lot of food choices that we then again introduce if we get good health within the first 14 days or month. So it's elimination diet is one thing. It's optimizing sleep, exercise, and I use meditation. Or I suggest meditation for my clients
Yeah.
because I really think that if you get good sleep and you meditate, it's easier to do the right food choices and leave any mental toxicity behind you, like everything that bothers you in your path, like leave it. It's easier to take a thought. When you meditate, you learn to control your thoughts, but I think it's easier for you to take one part that you've been thinking a lot about and just parking it in the past and moving on. I think that helps your gut also, or your mental health, or your overall health.
So those four pillars are equally important in functional medicine.
I would say so. I think
Yeah.
you can eat right and have a stressful life, and then it's not good anyway. So you need to improve all the parts, all the pillars. If you leave out one pillar, you can still have a bad health. So when people come to me, a lot of people have tried to eliminate gluten or lactose, but if they still have sleep 4 hours a night, and have a stressful working life, then it might be not the right way to find out if you're gluten or lactose intolerant. It like you need to improve all pillars.
Yes. So for the diet, you mentioned elimination diet. What are the usual things you try people to eliminate from their diet? Is it dairy, eggs, and some other things as well?
Yeah, I normally keep eggs in because eggs is of course eggs can be a problem, but mostly it's the lactose and gluten that's the big triggers. But there's also lectins. Dr. Grundy is big on lectins, but I
Yes.
find that lectins, nightshade, stuff like that can also have a huge impact. Some people really react to it. Mushroom can also be a problem. So I don't eliminate everything in the beginning. I try to eliminate gluten, lactose, and lectins in the first trial. And if that doesn't work and people stick to the diet, then we maybe have to look at eggs or mushrooms, or is it high fiber? Is it fructose malabsorbent? It can also be easily just be the amount you eat, and it can easily also be the quality of the food you eat. So I always opt for ecological foods because without pesticides, we normally get better results.
Yes, we also try to eat ecologic but eliminating lactose can be. So I'm originally from Japan, so and in Japan we don't consume as much dairy product as in the Nordics, as you may be familiar with the Asian diet. I could imagine that telling Danish people not to consume any kind of lactose can be a challenge.
Oh yes, but I find gluten to be the biggest challenge for people. But the fun fact is that there's no other animals in the world that consume lactose after the fetal state. So it's very strange that us humans started to consume so much lactose.
Yes, that's true. There's so many different dairy products like cream and
Exactly.
yes, and they can be delicious. But yes, so you of course approach different patients very in an individual manner, I think. And so you basically address those four pillars, and simultaneously, maybe you recommend the patient to get the Aura ring to monitor their sleep and so on. Now, maybe let us discuss about addressing some specific health concerns at the clinic. Today, many people are interested in gut health, which we already touched upon a little bit. And they are interested in learning about how to improve the health of their gut. At the clinic, how do you approach gut health? I could imagine that was originally your own interest as well when you had personal issues with your gut health.
Yes, I'd say that 90% of the healing I do in the whole body of the clients is probably addressing the gut problems. Even though you have perfectly bowel movement one time a day, you can still have gut problems that accelerate autoimmunity and stuff like that, because the body has a huge um, reserve. So it's, even though your gut is leaky or your gut is in problems, your big bowel still absorb all the water and you still get the perfect bowel movements every day. So you can still have problems in the gut. So even though people don't say they have any problem with the gut, I always try to optimize the gut health.
Yes.
So the biggest factors. Oh yes, come.
Yeah, sorry. So you mentioned the perfect gut health. I just got curious. What is perfect gut health? I mean, for example, how many times per day would you think like if a person has a perfect gut health, how many times a day should one have a bowel movement, for example, once or twice or three times?
So, what in normal medicine, you say that a type 3 to type 4 on the Bristol stools chart is a normal, uh, yeah, bowel movement, and 1 to 2 times a day is normal bowel movement.
Mm-hmm.
It's I would say best case scenario, I would say a type 3 one time a day,
Mm-hmm.
and I really try to thrive towards that. The problem is that if you have like small intestinal bacteria overgrowth, you can have different types. You can have the diarrhea type, which is normal, more normal to seek help in the clinic than the constipation type. And the constipation type of small intestinal bacterial overgrowth is harder to help because they still have a intestinal overgrowth, but it doesn't. It maybe they have a type 2 uh, bowel movement like once a day or maybe every second day,
Yeah.
but they still have all the autoimmune problems from the uh, overgrowth of bacteria.
Yeah.
So
Yeah.
it's harder to help.
Yeah, I agree. I think that I actually have a bowel movement every day, and I do think it's very important. Actually, I feel healthy in that way. But I do know many people who have like only like occasional. Like I know somebody who says like I have bowel movement only like once in 3 days, but regularly. So he thinks like it's healthy. But I'm trying to tell like but it is not healthy. But it's very
It's not
difficult to,
normal.
yeah, it's not normal, but they don't really know that. And I think it's important to really make them aware that it is not. And those people, as you say, don't usually come to see a doctor, let alone a functional medicine doctor, because they are convinced that it's normal. So I really want to say loud that it is not normal.
It is not normal. It's
Yeah.
but the thing is, if those kind of patients don't have any other problems, then they don't see any problems with having bowel movement every third day, because it saves time. They don't have to go. But it's I would say if they start getting joint problems, skin problems, thyroid problems, lung problems, it can easily be addressed by helping out the gut to address the problem with the lower bowel movements, and it's probably because of dysbiosis.
So, what kind of like other symptoms or diseases even can be derived from gut issues? You already mentioned like lung, skin, like is gut really causing so many different symptoms all over our body?
I would say so. And the thing is, if you have a dysbiosis, if you have problems with your bacteria in your gut, and you have an immune system that's slightly overactive, it produces something called cytokines. It's interleukins, which is the communication things between the immune system. So it increases the cytokines in the blood, and the blood goes everywhere. So it can go to your brain, it can go to your joints, it can go to your to thyroid, lungs. So you can have like a dry cough. I had a patient with a dry cough for 15 years, and the healthcare system didn't know what to do. After a month on a good diet, she was off it, and she haven't
Wow,
coughed since. So
wow,
it seems so simple, but the healthcare system don't like acknowledge it. So it's
yeah,
yeah.
yeah. That's
She was
that's
really happy though, especially in these Corona times, because everyone was looking at her every time she coughed.
Yeah, that's actually big. I mean, you are like really being stared at, or you are maybe like not welcome to a supermarket these days if you are coughing all the time. So that's
No.
really makes. I can imagine she was very happy. But like, did she become better only by modifying her diet, or did you also recommend something like probiotic supplementation to her?
I mostly start my patients without probiotics to see if you turn too many handles, you don't know which handle has done the improvement. So I try to do it with the lifestyle changes, exercise, sleep, and I mostly do like normal supplements like multivitamin, D vitamin, omega 3 as like the base. Also maybe magnesium for the sleep, and zinc.
Yeah,
But that's like the basic I do for most patients, because believe that's a good fundamental part of good health.
yeah.
So then she did the lifestyle changes, the dietary changes, and the supplements, and the meditation, and she improved really quick. So there's no need to add up a probiotics. Probiotics is shown to be really helpful for a lot of conditions, but I would start off with the one part, with the easiest parts, and then I would add, if there's good improvements, but we're not perfect yet, then I could add a probiotics. Mostly I use soil-based probiotics because I feel that that's what we lack in nowadays agriculture.
Very interesting. So, what is good nutrition, or what are good foods for your gut health?
Yeah, the really good food for your gut health is the veggies that don't contain pesticides. Because in 2006 they started to pesticide everything. So if it's not ecological, then it's probably filled with pesticides, and pesticide will kill your good bugs, and you don't want that. So the best part is doing, and even things that you don't consider being filled with pesticides, like spinach, like strawberries, like all these things are full with pesticides if they're not ecological. So it's really good for your gut health to start eating ecologically off pesticides. But then, of course, it's the leafy greens, it's the veggies. That's really good for your gut buddies. They enjoy fiber a lot. So a lot of people that have problem with the gut, they lack the mucosa of the lining.
Mhm.
So they need to. There's different bacteria in the gut of a normal person, and it's butyrate producing bacteria. So they produce the mucosal layer if
Mhm.
they get the fibers. So you need to have, that's what you call prebiotics. That's food for the bacteria. That would be different kind of vegetables containing fibers. But if you don't have the bacteria that produce the butyrate, then it's a problem. If you kill
Yeah.
them with antibiotics or pesticides, then you can eat a lot of fibers, and you still don't get your mucosal layer built up as good as you would, or that you like.
Right. So the produce without pesticides and the leafy greens, veggies, which contain a lot of fiber, and in of course
Yes.
optimal amount, not too much. But so those are two big recommendations for getting started with optimizing gut health.
Yes.
Yeah, that's very interesting. Actually, in Japan, when we talk about gut health, people usually think about yogurt, and of course, that's a dairy product, which is maybe the first problem. But people, I think, in Japan, there is a very strong belief that like things like yogurt is very healthy for the gut health. Do you have any opinion around that? Actually, is yogurt good for gut, or maybe not?
I think yogurt has a good place in gut health,
Mhm.
but I think yogurt was like produced by the yogurt industry, of course, and then they added up some good bacterials like lactobacillus, which is a good bacteria that thrives in a lot of conditions, will thrive in the gut, and is a part of gut health in a lot of people.
Mhm.
I think that you can add probiotics without adding the yogurt component. You
Right.
could have coconut yogurt, which is not containing lactose, or you can take a probiotic instead. Like I would, some people are like, hey, you can have it the natural way in yogurt. Yes, but you can also just take a supplement. It
Mm.
contains the same without having the breakfast part in it.
Yeah.
I think I would not recommend yogurt with probiotics in the first run. But
Yeah.
if people get healthy and they want to experience with yogurt with probiotics, lactobacillus, and they feel that the body tolerates it,
Mhm.
then please continue. Like
Mm.
if your problems are over and you want to eat it, then please eat it. But if you have big problems with joint pain that persist and you can't get them away, maybe we should keep off different things for a while until you get better.
Right, makes total sense. And that's very interesting, actually. There's another very big health area, which is big interest for many people today, which I would like to discuss with you as well. That is immune health, of course, because of COVID-19. To start with, can you tell us how do you diagnose immune health? It's a actually very broad area of health, I think. Are there certain blood markers that reveal the health of the immune system?
Ah, it's again it's that's a big question.
Yes.
It's I don't think that, well, testing your immunity and how your immune health is probably the best test is to how many sick days have you had the last 5 years. So it's
Mhm.
not something you can test within like a year or 2 years, but having a good immune health is probably how many times you've been sick over the last 5 years.
Very interesting.
um, yeah, because you can say, hey, this is good for your immune system, but how do you test it? Like, how do you test it over the next 2 months, 3 months? Is it improving? Is it not improving? Of course, you can take all the classical healthcare um, tests of CRP and leukocytes, and but probably everything would be normal. Then you can go you can go after the low grade inflammation. You can go to TNF alpha, interleukin 6, and interleukin 10. And that would give you a suggestion. If you have low grade inflammation, is your body fighting something at the moment, and that would probably lower your immune system response, or it would be not as good if it was fighting something else. So that could be a way to test it. But overall, I would say I would just ask the person, how do you feel? Are you getting sick often? Do you have like a sore throat once in a while? Is your nose running once in a while? Like all these things would probably give a bit better indicator. Is a person having a good immune system or not?
Yeah. So
Or
there's
it could
no.
be acne
Yeah.
or other things.
Oh, okay. So it's like because immune system or immune health concerns the whole body, really. There's no really single, even like a set of blood markers or anything that could reveal the health of the entire immune system. That's what you are saying.
Yeah, I would say only if it's really bad, then you can see it on blood
Right.
markers.
Right. Yeah.
And I would say 99% of the population don't have a really, really bad immune system. So it's probably would look normal on blood samples, but they can still be sick every month. Like so I would say then they don't have that good immune system, or the immune system is fighting something, is working fine, but fighting something in another place, so don't have time for skin flora or stuff like that. So they get acne on their back or the face, and
Yeah.
that would also give me an indication that people are fighting something elsewhere in the body, so they cannot take care of normal skin bacterial flora.
There is actually another aspect of what you just said which interests me. You mentioned that 99% of the population probably turns out to be normal on a blood panel test, for example. But what I understand about functional medicine, and according to my own experiences as well, functional medicine doctors usually tend to interpret the same test result differently. Isn't it so? Like, let's say that you get thyroid TSH result, which is, let's say, 2.5, which is normal if you go to a conventional doctor. But functional medicine doctor, if you see that result and the patient is still complaining about fatigue and very persistent tiredness or something, then together with this information might decide that, well, this patient is still suffering from lack of a thyroid hormone, and take an action on it. Is that so that the interpretation of the result is actually crucial part of functional medicine?
I would say yes. Of course, we it seems like normal doctors look at the range that's been given to them from A to B, and if it's between that, then it's okay. And then they discard the clients or the patient's actual problems with fatigue or anything else. So I would say like normally I would more listen. Like conventional doctors look at a lot of samples and they see, okay, this number is red, that's bad. But I take a lot of action in looking at patients' symptoms instead. So if they still have a normal range, but they still feel fatigue, I would take action to try to improve it.
Yeah.
And most cases, I would say that we can hopefully cure all patients to live a normal, healthy life without medication instead of. So if patients have any problems at all, we
Yeah.
can probably fix it with functional medicine.
Yeah, I cannot agree more. Going back to the immunity discussion, if the patient's immunity is compromised, let's say that he or she is having many sick days during the last 5 years, for example, how do you approach immunity diseases or compromised immunity at the clinic? Of course, it's also again a big question, but how, like, you can maybe mention a case study as well, but how do you approach such case?
I would probably, it is a big question, but I would
Yeah.
say that a lot of the patients that has a lot of infections is because of either they have mineral or vitamin deficiencies. So
Hmm.
I would totally look into that. That could be a good reason. Either that I would optimize their gut health and their
Hmm.
sleep habits. It can also be something really like simple, like are you touching your face too much?
Hmm.
Like if people touch their face, there's a lot of bacteria on your hand. If they pick their nose, like simple things like that can make, yeah, make you have a lot of infections in your throat or your nose.
Yeah.
It because it's so basic, but not not everyone address the problem. Are you touching your face all the time?
But that's
That could
really
also
fascinating. Yeah. Mm.
give acne and stuff like that, because so it's very simple advice, but not every doctor look into other cases like that. They just say, okay, your blood samples looks fine, so nothing's wrong with you.
Yeah, but that's really fascinating, and I think that's one of the lifestyle interventions which may be difficult to like follow the patient. I think if you tend to touch your face often, it's a kind of habit which is maybe very difficult to stop, and there is
Well, if
no
you don't
way.
get,
Yeah,
if no
yeah,
one address it, then you won't stop it. But if I
yeah,
say you really have to stop touching your face, then hopefully we can talk about it the next consultation, and people say, okay, I don't touch my face as much, and I take this multivitamin or this C vitamin, and now I actually feel better, hopefully.
Yeah, so for the infection, that's quite interesting. I actually didn't think about the vitamins and minerals to treat or improve infection. So you already mentioned the vitamin C. Which vitamins and minerals are usually important for infection?
I just did a video about this, but I would say the most important is probably D at the moment. Get that one
Hmm.
in level,
Yeah,
and then I would say zinc and C vitamin as antivirals.
yeah,
Um, it's really hard because there's a lot of studies on COVID-19 and D vitamin and zinc and C vitamin, which shows that people that admitted to the hospital has really low levels of D vitamin, C vitamin, and zinc. But is it because of the acute? Is it because of this? The system is not working properly when they get the COVID-19, or is it after they get the COVID-19? The reaction has been big, and that's why they use a lot of these mineral, and that's why it's low. Or were they
mm,
low before? It's really hard to know when you don't have like double-blinded randomized studies.
right. Yeah, it's
But
like
I would
it's yeah.
say it's very very cheap to take these supplements, and it doesn't hurt you. So it's like, why would you not just take them to be in
Um,
the right
Yeah,
range?
and yeah, and in countries like Denmark and Sweden, where I live, there's really no possibility to get outside in the winter. I mean, you could do that, but you don't really get enough amount of sunshine on your skin to produce your own vitamin D. So, would you recommend supplementation, like especially during the winter time in this northern altitude?
I um, i uh, heard one of my I'm a big fan of Dr. Ruscio.
Hmm.
He's an American functional medicine doctor, and he had a podcast with a guy that invented D vitamin or find the chemical formula for D
Hmm.
vitamin.
Hmm.
So this guy must be really big in D vitamin, I reckon. And he said he takes a double dose in winter and a single dose in summer. So
Mm.
even though it's summer, he still supplements with D vitamin because it's a
Yeah.
crucial part, a lot of chemical actions in the body, and it's really not so good to be in the low range. So yes, I suggest everyone takes D vitamin, even though it's sun, because we're probably born to be naked and in the sun all the time, and then maybe he says maybe then we get the full amount in D vitamin. But now we're dressed up with clothes; it's only our hand and face that's in the sun, maybe you got shorts and t-shirts on in summer, but you still like biggest part of your body is still covered up
Yeah.
with clothes. So
Yeah.
it's really hard for your body to produce all the D vitamin that you really need.
What is the optimal range for vitamin D? There seems to be a little bit of a difference according to like functional medicine and conventional medicine.
Yes, I have a blog I can link to you where I
Yes.
talk about this.
Yeah.
Um,
We
so
will.
I
We
get the
will.
opt.
Yeah, we will link that to the show note as well. Then, so you have written a whole blog about the
Yeah,
optimal
I have a
range.
blog
Yeah.
about D vitamin, but to sum it up, I recommend that you should be around. Um, just a second.
Yeah.
I would recommend you be around 40 to 60
Yeah.
nanogram per milliliter,
Yeah.
and that's 100 to 150 nanomole per liter.
Yeah. I think that's a range, and I often hear like people like Dr. Marcola and many functional medicine doctors mention, and that's slightly or actually quite significantly higher than. I mean, if you go to a conventional doctor and he has taken a look at your blood test result, you have vitamin D level of let's say 25. It is still normal, but it's not optimal.
Exactly,
Yeah,
exactly, and that's what we try to get the optimal levels instead of just a normal level.
yeah.
Unfortunately, my podcast on my blog is only in Danish, but hopefully people can Google Translate it at this moment. We're working
Yes.
on a translator.
Yes, Danish is easy to understand. No, maybe it's not, but I will make sure to put it in the show note. And listeners who have followed our conversations so far may have become interested in to visit your clinic. So please maybe tell us when functional medicine is a better option than the conventional medicine. I mean, you already mentioned a little bit about patient compliance. Is there lots of lifestyle interventions when you go to a functional medicine doctor? And if the patient's motivation is low, or if he or she is stubborn or something, maybe it's not a good idea to go to a functional medicine doctor.
No, you need to have the right mindset when you come here. You need to be able or to be ready to change your diet and lifestyle if you want to succeed with this treatment. People that should come here is mostly people that don't feel that they got the right treatment in the healthcare system, or they feel they just been suggested to take pills. Like if there is, I never suggest people to take pills. So I try to get people off the pills. So if you take a lot of medicine, there's probably a functional medicine way that we can make you take less medicine or maybe get you completely off the medicine. So if people don't want to take a lot of medicine uh, treating symptoms, but treating the root cause of the problem, then they should definitely go to a functional medicine doctor.
Right. And what can a patient of your clinic expect to be improved and how fast? Of course, it's very difficult to say case by case, but is there any kind of, because it's also very important for the motivation, right? They really want to usually see an immediate effect.
Yes, people need to be motivated, of course, but I would say if you have, depending on the problems, because it could be so many different things. If you have problems that persisted in your system for, let's say you're 30 years old, and since you were 15, you had problem with A, B, and C, you cannot expect it to go away in 10 days. Like you had your problems for 15 years. Supposedly, it would take some time to adjust the imbalances and the problems you have in your body, depending on how strict you want. If you want to fast bad bacteria in the gut, you have to do some intermittent fasting for a long time. If you wanted to do it fast, you can eat one time a day, and then it will go faster than if you eat twice a day. Like so, it's up to the patient how fast you want to get into balance your
Yeah.
problems. So
Yeah.
it's very different. So you need to see the different patients and see, okay, what can you manage? How fast can we go?
Yeah, it's yeah, absolutely. I totally agree. One thing I really was initially interested about you was that you are vascular surgeon, and then you are now a partner at the Copenhagen Center of Functional Medicine. Such a traditional training. I thought like surgery sounds like a very traditional, conventional medicine. But do you see functional medicine like complementary to conventional medicine like surgery? For example, do you sometimes refer to the clinic, the Copenhagen Center of Functional Medicine, your surgical patients whom you operated for some vascular problems?
I probably should refer all the patient I treated for vascular problems to my clinic, because most of them is probably lifestyle changes like 40 years before you do the surgery. So if they changed way before, then it would probably not have the problems of undergoing vascular surgery. But I normally don't mix the two together. So when I'm at surgical wards, of course I do the surgical stuff, and when I'm at my clinic, I do the functional medicine stuff. But I try not to mix it too much. Of course, tell
Right.
everyone to start walking and eat less sugar and junk food, processed food.
Yeah, that's very important. Basic, but very important, of course.
Stop smoking. It's
That's very
yeah,
big.
it's very big.
Yeah, that's really big. I know that you have been very generous with your time, Ulrik, but our time is running up. But I wanted to ask, so Copenhagen Center of Functional Medicine is one of, I think, only a few comprehensive functional medicine clinics in the Nordics. Anything you would like to add to the listeners to know about the clinic?
No, but please check out the website ccfm.dk, and please don't hesitate to fill out a contact form, get in touch. I'd be happy to answer questions there as also. So it's just fill out a formula, send in questions. Maybe we can find out if I can help you or not. So yeah, don't
Yep, and
hesitate.
I will make sure to get the link, clinics, the link to the show note as well. And finally, if people want to know more about you and the clinic, you mentioned the clinic's website already, but how can people
Yeah,
find
by
you?
the clinic's website, ccfm.dk, or send me a mail at uh@ccfm.dk. I'll get back to you.
Okay,
They can also follow us on Instagram, ccfm.dk, or Center of Functional Medicine on Facebook.
initially, actually, I wanted to visit your clinic and make a show by sharing with the listeners my experience as a real patient at the center. But because of the travel restrictions between Denmark and Sweden at the moment because of COVID-19, it made it very difficult this time. But maybe next time we can do that for another podcast. Yeah.
Yes, of course, of course. We can do that. I also have Zoom meetings, Zoom consultations, so everything is functional and well offline, also online also. But yeah,
Sounds
I'll be happy to
fantastic.
have you in the
Fantastic,
clinic.
Ulrik. Thank you so much again for today's conversation. It was great talking to you, Ulrik. Thank you.
Yeah, thanks for having me.
This was a podcast from Kenkoax. To follow us, subscribe on the channel Kenkoax on all the places where you can find podcasts.